Okay, later on I'm going to see a patient who has Pompholyx eczema. If you don't know what that is, you can think of it as hand eczema. Some people have even foot eczema, and it's a similar kind of situation because on the hand or the foot you got little bubbles and bumps growing, and then it gets really itchy and it's kind of irritating. The usual solution is to put steroid cream, and for some people it solves it, but not everyone, and that's why people come to see us at Chinese Doc. Okay, done. This patient sounds like a situation that I may be able to help. So I told her, let's not do acupuncture first. There's some other patients who do acupuncture first, but in her case I said, let's do the herbs and we'll see in 3 to 5 days how you respond to the herbs. This is important because even though Chinese medicine is natural, some people do respond negatively to herbs, and we want to watch that they do not respond negatively. And that's why we have this feedback where they write us and say, hey, we're doing okay, or hey, I don't think I'm doing well with the herbs. From there, we know how to pivot, and we don't have to wait until the next consultation because that would be dangerous. We want to nip it in the bud. Anyway, in her situation, you can see in the video that the hands are really angry. Maybe we'll talk in another video about where the hands don't look so angry, but in her situations, the hands are really angry, and we have to use a stronger formula. And the formulas we use are usually cold in nature, which is also why we ask the patients to use the herbs after food. Must be after food. These are cold herbs. The cold herbs are also good because they are like herbal antibiotics. And they usually are able to clear the redness in their hands, and that may also reduce itch by a little. But I want to manage expectations that the reduction in inflammation is usually quite gradual. And for those who want to know how long this takes, you know, as this goes down, people come and see us less, and at some point it doesn't bother them so much and they get on with their normal life, and then it disappears. The second thing to also be aware of is that in Pompholyx eczema, stress is a big factor. And in the case of this patient, the stress was her exams. And her exams are over now, but her hands are still inflamed. So we hope that this type of a formula for her will be useful.